What is the nerve supply of parotid gland? Facial. Facial nerve, I have repeatedly told you, facial nerve is the seventh cranial nerve. Seventh cranial nerve. It supplies, it is the motor nerve. It supplies all the muscles of the face developed from each and every one is important. It develops from second branchial arch. So any muscle which will develop from second branchial arch should be supplied by the facial nerve. You keep it in your mind. Right? सामने पूरा खाली है, पीछे क्यों बैठे? Now, what is the function of the parotid gland? What is the function of the parotid gland? बोलो. Parotid gland क्या है? किस टाइप का ग्लैंड है? हाँ?
Endocrine gland.
Endocrine gland secretes its product within the blood. It has got no duct. Ductless gland is endocrine gland. It is ductless. Parotid is ductless. It has duct. बहुत बड़ा duct है. Parotid duct. तो इतना बड़ा जब duct है तो कैसे हो सकता है वो? Endocrine. It is exocrine gland. What it produces? What it produces? So it is salivary gland. So parotid is a salivary gland and it is the biggest salivary gland. There are other two small parotid salivary gland. One lies underneath the mandible, so it is called submandibular, and one lies beneath the tongue, that is called sublingual gland. When it is parotid salivary gland, so it will secrete saliva. So any gland which secretes something, that should be supplied by secretory nerve. In case of parotid gland, there is a auriculotemporal nerve. I have already told you, auriculotemporal nerve. That auriculotemporal nerve supplies the parotid gland, and another nerve which is coming from the cervical plexus, that is called great auricular nerve. Great auricular nerve directs towards the auricle. That great auricular nerve also supplies the parotid gland. Now this auriculotemporal, this great auricular nerve supplies sensory fibers. And along these sensory fibers, some fibers, that is called pseudomotor fibers. Pseudomotor fibers means that will supply the sweat gland, which is coming from the sympathetic. So that also passes through the great auricular nerve. So great auricular nerve not only sensory supply, but also it supplies pseudomotor fiber to the sweat gland. And auriculotemporal nerve, it supplies secretomotor fiber to the parotid gland. When that nerve will be stimulated, there will be secretion. That is coming through the auriculotemporal nerve. These two things you will remember. Auriculotemporal nerve carries secretomotor fiber. Now you will be asked to trace from where it is coming, this fiber. At this moment, it will be difficult for you to remember. That's why I am not mentioning that. After the completion of the brain stem, then you will understand it. So then again it should be discussed. Now, what is Frey syndrome? If there is any injury of the parotid gland, both nerve will be severed, section will be cut off. Now what happens? One nerve, there is cross connection. there is cross connection between the auriculotemporal nerve and great auricular nerve. After injury, a cross connection हो जाता है. Because of this cross connection, one secretory nerve is connecting with the great auricular nerve. So what happens whenever you will eat something? So that stimulates saliva. So impulse for salivation, actually what happens? It passes through the great auricular nerve. पहले impulse salivation के लिए कोई impulse जरूरी होता है, तो that impulse because of this cross connection will pass through the great auricular nerve. So what will happen? We know great auricular nerve supplies the sensory supply, so that area will be hyperesthetic. Hyperesthesia means excessive sensation. कोई जाएगा अगर excessive sensation हो गया, टच करने से आपका जो है पता चल जाता है, hyperesthesia हो जाता है, over sensitive. And also there will be perspiration, and it is supply pseudomotor fiber. Pseudomotor fiber is supplying the sweat gland, so there will be sweating. So whenever the person who has developed such symptom, whenever he will eat something, there will be perspiration and hyperesthesia over the parotid region. This is called Frey syndrome. Sometimes Frey syndrome may come as a short note or may be asked in your practical exam. So you should say Frey syndrome develops due to injury of the parotid gland. What happens? Main thing is here there will be cross connection between the great auricular nerve and auriculotemporal nerve. So impulse for salivation will pass through this great auricular nerve and it will produce hyperesthesia as well as perspiration. So this event is known as Frey syndrome, right? Now, why if parotid is enlarged due to infection, that is called mumps. We call it mumps. Mumps may be due to, maximally it is due to the viral infection. So what are the other organ of our body which may be involved at the time of mumps? Bolo. Suppose patient has developed mumps. Then what you will ask? What are the other symptoms? That virus may involve ovary, that virus may involve testis, that virus may involve pancreas. So apart from parotitis, inflammation of the parotid gland, parotitis, apart from parotitis, the patient may also complain of pancreatitis. Involvement of the testis means orchitis. Involvement of ovary means oophoritis. So oophoritis, orchitis and pancreatitis, these three symptoms may also accompany the parotitis, right? Now tell me why the parotid inflammation is very painful. Why it is very painful? I have repeatedly told in my class why it is very painful. If the parotid is inflamed, inflammation may be due to infection or due to some other reason. If there is inflamed parotid, it will cause severe pain. Why?
It is enclosed in the deep fascia, paracridomescenatic fascia.
Very tough, very good. Parotid fascia, I have already told you. What is parotid fascia? Where from it is coming? Parotid fascia कहाँ से आता है? From where it is coming? Neck में 3 layer है. I have already told you. What is that?
Pretracheal, prevertebral, investing layer.
So from which layer this parotid fascia is coming? No. Investing layer. Investing layer is coming and it is covering the outer aspect of the parotid gland and it blends with the outer covering of the masseter muscle. Masseter का जो muscle का जो most outer covering होता है इसका क्या नाम है? 3 terms: endomysium, perimysium, epimysium. So what is the most outer covering of the muscle? Epimysium. So it blends with epimysium. This epimysium along with investing layer of the cervical fascia, which forms the outer covering of the parotid gland, it is very tough and unyielding. You should mention this. Very tough and unyielding. That's why when parotid gland will be swollen within it, it will cause tremendous pain. Now that patient has come to you. Now what will you do? You examine and you found that pus has developed within. Then your duty is to release the pus, to drain the pus. Then what will you do? How will you cut the parotid gland? कैसे? The incision which will you give is very important. The incision which will you give to drain the pus is very important. What kind of incision you will give? बोलो. बोलेंगे कोई दिन? You know all the nerve fibers coming like that. So if you give incision like this, vertical, all nerves will be severed, cut. So you have to give incision this type, horizontal incision. You should give from the root of the ear like this, horizontal, because nerve is coming like that. So there is least chance of injuring. One or few branches may be cut, but all branch will be saved. So you will give horizontal incision. That is called Hilton's incision. Very important. Hilton's. This is called Hilton's incision. It is the horizontal incision. You should give, and when you will reach after cutting the parotid masseter fascia, you will reach the gland, and the pus will come out, and patient will be immediately relieved. Right? So you will remember this incision, horizontal incision. Carotid gland has got two parts, superficial part and deep part. Superficial and deep part, they are connected by some glandular tissue that is called isthmus. And between these two parts, deep and superficial part, these nerves and veins actually run. This nerve and vessel lies between these two planes, superficial and deep. So surgeons actually try to find this plane. If he, at the time of removing the parotid gland, parotidectomy, he will try to find this plane and will cut and remove the superficial part, keeping intact the nerves and vessels. That plane is called Patey's plane, Patey, P-A-T-E-Y. That is called Patey. These are all applied aspect of this gland, Patey. So the surgeons follows this Patey's plane, right? Sometimes you may be given the viscera of parotid gland. Now you have to hold it in anatomical position. Now parotid gland has got how many borders? Parotid kota border আছে?
Interior, anterior border, posterior, তারপরে একটা anterior medial, posterior medial.
Sheet surface, border को.
अच्छा, border तो anterior, posterior.
Anterior border, posterior border and medial border. These three border divides the gland into three surface. What is that? Anteromedial, posteromedial and superficial surface. Anteromedial, posteromedial, superficial surface. Now parotid duct. Parotid duct will come. It come as a short note. It will come as a surface marking. What is the length of the parotid duct? What is the length of the parotid duct? 5 centimeters. Very good. And diameter? 3 millimeter. 3 millimeter. After coming out from the parotid gland, it undergoes some bending. How many bending it undergoes? কতবার bend হয়? How many times? And after bending, where it opens?
bend to 3 bar.
তিনবার আছে, very good, very good, তিনবার। First bending টা কোথায় হয়? Where first bending occurs? First bending, where you will try to find this parotid duct. কোথায় খুঁজবি? যদি you are asked to show me, if examiner asks you, show me the parotid duct, where you will find? From which border it comes out? From the anterior border it comes out, and then it passes over the masseter muscle. It passes over the masseter muscle, and at the anterior margin of the masseter muscle, it bends at right angles. Now it will pierce. এখানে যেটা থাকে pad of fat, suctorial pad of fat, বা buccal pad of fat. It will pierce the buccal pad of fat. Then it will pierce buccopharyngeal fascia. Buccopharyngeal fascia lies over the buccal muscle. So after piercing the suctorial pad of fat, it will reach the buccopharyngeal fascia. It will pierce buccopharyngeal fascia as well as buccal muscles. Then it will enter into the submucous level. Again here it will take right angle turn. This gland will pass along the submucosal plane, and finally it will pierce the mucous membrane, and it will open at the level of, it is important, it will open at the level of upper molar tooth. Upper molar tooth. Which molar tooth? There are 3 molar tooth. কোন molar tooth এর level open করে? Upper molar tooth. Which there are 3 molar tooth. Which molar tooth এর level open করবে? Second molar. Very good. At the level of the crown of the second molar tooth. Right? So it is the opening of the parotid duct. And this parotid duct and below this parotid duct, one important branch of the facial nerve runs. What is that? How many branches of the facial nerve here within the parotid gland which come out? 5. What are the name of these 5 nerve? This one is temporal, zygomatic, as upper buccal, so there will be lower buccal, lower buccal, then marginal mandibular, cervical. Very good. Fine. তাহলে 5 represent 5 branch. This is the temporal, this is the zygomatic bone, so zygomatic, this is the buccal, the mandible, marginal mandibular, this is cervical. This buccal again divided into upper buccal, lower buccal. This upper buccal and lower buccal lies upper buccal above the parotid duct and lower buccal below the parotid duct. Right? So these are the 5 branches you will remember. These five nerves, as it is passing through the parotid gland, does it supply parotid gland? Does it supply? Facial nerve supply parotid gland? जोर से बोलो ऐसे. No. I have already told you, parotid gland is supplied by two nerves, auriculotemporal and great auricular. Right? And this facial nerve will supply the muscles of the face. Here you will find another buccal nerve. In the dissection of the face, there is another buccal nerve, that is a branch of the mandibular division. Trigeminal nerve, you know trigeminal nerve is the third cranial nerve. Third cranial nerve. Which cranial nerve? Trigeminal nerve is which cranial nerve? Fifth cranial nerve. Trigeminal means three. Ophthalmic, maxillary and mandibular. This mandibular division has got, what are the branches of the mandibular division? Auriculotemporal and buccal, and one branch buccal and mental. So this buccal branch, so it is buccal is a branch of the mandibular division, as well as there is a buccal division of the facial nerve. Now these two structures supply is what? Buccal branch of the mandibular nerve and buccal branch of the facial nerve. So tell me what structure they supply. Buccal branch of the trigeminal nerve. I have already told you trigeminal supply the skin. So that will supply the muscles over the vaccinator and mucous membrane lining the vaccinator. That will be supplied by the buccal branch of the mandibular nerve, and buccal branch of the facial nerve will supply the buccal muscle, as is motor nerve. Keep it in your mind. মনে থাকবে তো? এইসব বেসিক জিনিস মনে রাখতে হবে, পরীক্ষার সময় এগুলো জিজ্ঞেস করবে। Now come to the আর কি থাকলো? Now come to the anterior triangle. Today you will be shown the carotid triangle. What is the boundary of the carotid triangle? This is the clavicle, this is the manubrium sterni, this is the mastoid process. From mastoid process goes the superior nuchal line. Sternocleidomastoid. Sterno means it takes origin from sternum. Cleido means it also takes origin from the clavicle. Clavicle is also known as cleido. Mastoid means it is inserted at the mastoid process. This muscle is divided into four parts. The muscle which is taking origin from the manubrium, that is tendinous in origin. It is tendinous. And muscle which is taking origin from the clavicle, that is muscular. So the part which is taking origin from the clavicle, it is muscular, and the part which is taking origin from the manubrium is tendinous. This is again divided into the muscle which is going to the mastoid. It is called sternomastoid. Mastoid process. Again, some fiber is going to superior nuchal line of the occipital bone. So it is known as sterno-occipital. তাহলে sternomastoid and sterno-occipital, right? Now, from the clavicle, which is going to the superior nuchal line is known as clido-occipital বা clido মানে clavicle, clido-occipital, and which is going from clavicle to the mastoid process, which is known as clidomastoid. তাহলে four components: sternomastoid, sterno-occipital, clidomastoid, and clido-occipital. Out of these four components, only the clidomastoid lies in the deeper plane. Clidomastoid lies in the deeper plane, and all the three lies in the superficial plane. Right? Now, come here. So it is the posterior border of the which triangle? I am carotid triangle. Now here you see, suppose here lies the hyoid bone. So from the inner aspect of the mastoid process takes origin the posterior wall of the digastric. So this is the mastoid process from its inner aspect and is coming to the hyoid. Right? This is the posterior belly. From here, another belly will go like this. This is called anterior belly. These two belly here becomes tendinous, intermediate tendon, and there is a loop. That loop is attached to the hyoid bone. So this is the posterior belly. This is the anterior belly of the digastric. Right? There is another muscle. You have found that muscle within the posterior triangle, that is the inferior belly of the omohyoid. It is the part of the posterior triangle, posteriorly, it is the posterior triangle. During the study of scapula, you have found there is a notch, suprascapular notch. From its medial margin takes origin the inferior belly of the omohyoid. Inferior belly of the omohyoid. So from there it is inferior belly of the omohyoid is going there. That is called the posterior triangle. Now it will come out and you will be to the hyoid bone. It is the superior belly. Now tell me the boundary. Posteriorly the anterior margin of the sternocleidomastoid, anteriorly and above. This is the posterior belly of the digastric. Anteriorly and below, this is the superior belly of the omohyoid. So this is the carotid triangle. Carotid triangle. Here you will find the many branches of the carotid artery. From carotid artery. Carotid artery is coming from where? This is the arch of the aorta. This is the arch of the aorta. This is the right side. From the right side, this is the brachiocephalic trunk. Brachiocephalic trunk will divide into two. One is subclavian artery, right subclavian artery, and common carotid artery. This is the common carotid artery. This common carotid artery, and left common carotid artery is directly from the earth of the aorta. At which level this common carotid divides? At the upper margin of the thyroid cartilage. Suppose here there is thyroid cartilage. This is thyroid cartilage, its upper margin. At this level, it will divide into two. Two. External carotid, internal carotid. External carotid, internal carotid. Now, sometimes to confuse you, sometimes examiner may ask you, what are the branches of the internal carotid artery in the neck? What are the branches of the internal carotid artery in the neck? Then you should say that there is no branch of the internal carotid artery in the neck. Internal carotid artery only will give branches within the cranial cavity, within the brain. Only the branch is given up by the external carotid artery. Now you know this internal carotid artery and common carotid artery lies within the sheath. What is the name of that sheath? Carotid sheath. So carotid sheath, if it comes as a short note, carotid sheath is coming from where? Carotid sheath is formed by anterior wall formed by the pretracheal layer and posterior wall is formed by the prevertebral layer. So within this carotid sheath, what structures lies? Suppose this is the carotid sheath. This is carotid sheath. This is lateral aspect. It is a medial aspect. It is the anterior aspect. It is the posterior aspect. Now, within it, three structures lies. Number one, laterally lies vein. Which vein? Internal jugular vein. Medially lies which artery? Medially lies which artery? Either common carotid or if I take section above the upper margin of the thyroid cartilage, then it will be the internal carotid, and if it is below, then it will be the common carotid. Right? Suppose it is below the upper margin of the thyroid cartilage, so it is common carotid. This is common carotid, CC, and the internal jugular vein. In between and behind lies one important nerve, that is vagus nerve. Lies here vagus nerve. Solid structure, vagus nerve. On the anterior wall of the carotid sheath, one important loop lies embedded. Embedded means it lies within the anterior wall. What is that? Ansa cervicalis. Very good. So it is the anterior aspect. So here lies the ansa cervicalis. Ansa cervicalis. And behind the carotid sheath, one important nerve lies behind the carotid sheath and posterior to the carotid sheath. Here lies another important structure. What is the name of that structure? Sympathetic trunk. It is sympathetic trunk. Common carotid artery, internal jugular vein, ansa cervicalis. Right. Now, What are the structures of the which structure pierce the carotid sheath? Which structures pierce the carotid sheath? External carotid artery pierces the carotid sheath. It pierces and comes out. And tributaries of the internal jugular vein pierce the carotid sheath. Now here you see, this is the division of the internal carotid and external carotid artery. Now these two positions you should remember. Which one lies the relative position of the external carotid or internal carotid artery? Anteriorly lies the external carotid artery and posteromedially lies the internal carotid artery. Suppose this is the internal carotid artery, it lies posteromedially. This part, beginning part, there is a fusiform dilatation. There is a fusiform dilatation at the beginning of the internal carotid artery. That is called carotid sinus. This carotid sinus may come as a short note. Why carotid sinus is important? Carotid sinus, where it lies? It is the fusiform dilatation of the beginning of the internal carotid artery. Why it is important? It acts as a baroreceptor. Baroreceptor, what it is? Baroreceptor? Pressure, blood pressure. If the blood pressure is increased or decreased, it will respond. It will respond to the pressure, right? If pressure is increased within the cranial cavity, it will reduce, right? Now it is supplied by which nerve? That is actually mediated by nerve. It is supplied by which nerve? Well, Herring nerve, very good. Herring nerve is coming from where? From which cranial nerve? Herring nerve is coming. Herring nerve is a branch of the glossopharyngeal nerve. Herring nerve is a branch of the glossopharyngeal nerve. Apart from that nerve, another two nerves is supplying this. One is the branch from the vagus and one from the branches of the sympathetic trunk. So it is supplied by three nerves: sympathetic nerve, vagus nerve, and herring nerve of glossopharyngeal. These three nerves supply the carotid sinus. It acts as a baroreceptor, right? Now, if it is hyperactive, sometimes in some cases it becomes hyperactive, then what will happen? If someone wears tight collar, if collar is tight, that may be stimulated, and if it is stimulated, it will reduce the pressure. Due to the reduction of pressure, which will happen? There will be ischemia of the brain, and so you will feel dizziness. Matha ghurbe. If it is severe enough, then you may also faint. That is called syncope. So if someone has hyperactive carotid sinus, and if that fellow wear the tie and tight knot, so he or she may feel syncope. Syncopal attack means temporary loss of consciousness. Temporary loss of consciousness is called syncope. So if that kind of case come to your clinic, first of all you will consider the carotid sinus syndrome, right? Now there is another important structure lies behind the bifurcation of the common carotid artery, that is called carotid body. Carotid body. That carotid body is brown in color, oval in shape, and it lies behind the bifurcation, and it is also supplied by these three nerves: glossopharyngeal, vagus, and sympathetic. What is the function of this carotid body? It acts as a chemoreceptor. It acts as a chemoreceptor. What is chemoreceptor? What it detects? It detects the tension of the carbon dioxide or oxygen. If oxygen level is lower, it will stimulate and it will increase the blood pressure. It will increase the pulse rate. It will increase the respiration rate. Right? It is a function of the chemoreceptor. দুটোই আসতে পারে পরীক্ষাতে স্বপ্ন। Both may come. Now branches of তোরা কি দেখেছিস কি একদিন? ট্রায়াঙ্গেল দেখেছিস তো কি? Now what are the branches of the external carotid artery? बोलो एक ब्रांच का नाम बोलो। One branch. Occipital artery. वाह, very good. एक बोला, बोलो। This is facial. How will you identify the lingual? There is a loop. There will get a loop. Lingual artery will show a loop like this. It will show a loop. This artery, facial artery also show a loop. Both will show a loop. But lingual artery will be crossed by nerve. Lingual artery will be crossed by nerve. That nerve is known as hypoglossal nerve. So, if there is a hypoglossal nerve and at this level the artery, you will find that is called lingual artery. Now above the lingual artery you get facial artery. So these are the anterior branch. Now what are the posterior branch? Posterior branch you will get occipital. You will get occipital and posterior auricular. And posterior auricular. এটা হচ্ছে occipital, this is posterior auricular. And ultimately it will divide into terminal branch. That terminal branch will find within the parotid gland two division. One is maxillary and one is superficial temporal. There is another branch that lies medially, that is called ascending pharyngeal. There is another branch lies medially. So I am drawing it dotted line. That is medially. That is called ascending pharyngeal. Now you have to remember all these branches. First branch which lies medially, that is called ascending pharyngeal. It is going to the pharynx. Anteriorly it is coming out first superior thyroid. It is going to the thyroid gland. Then lingual, its name signifies it is going to the tongue. Facial, going to the face. And maxillary and superficial mandibular. Right? Now this superficial mandibular and facial artery. Superficial mandibular you will get on the temple here. if you press, you can feel the pulsation of the superficial temporal. If at the anterior margin of the masseter you press, you can feel the pulse of the facial. So these two artery is known as, এই দুটো আর্টারিকে কি বলে? Anesthetist artery. Why call anesthetist artery? Anesthetist artery क्यों उसको एनेस्थेटिस्ट आर्टरी क्यों कहता है? जब एनेस्थीसिया देते हैं ना पेशेंट को, तो एनेस्थेटिस्ट कहाँ पर रहता है? हेड एंड में रहता है ना टेल एंड में रहता है एनेस्थेटिस्ट? हेड एंड. तो हेड एंड हाथ ऐसे रहता है, तो हाउ he or she will feel the pulse? It is not possible to feel the radial pulse. It is within the cover, so it is lies, and the anesthetist is standing at the head end, so he can feel the pulse of the superficial temporal, or he can feel the pulse of the facial. So these two arteries is accessible to the anesthetist, so it is also known as anesthetist artery, right? নামগুলো মনে থাকবে এবার? Can you remember? Ascending pharyngeal, superior thyroid, lingual, facial from the anterior aspect, posterior aspect, occipital, posterior auricular, terminal division, superficial temporal and maxillary. Right?